Hello everyone, I am back with the new topic from the endocrinal and metabolic disorders, and the today's topic is viral hepatitis. This viral hepatitis is mainly concerned with the liver or something disorders of the liver. This viral hepatitis mainly leads to the inflammation or infection in the liver. So we'll see what is viral hepatitis. So here, a systemic disease with primary inflammation of liver by hepatotropic viruses, commonly and rarely by non-hepatotropic viruses. So this is mainly caused due to the inflammation of the liver, which is caused by the viruses. These are divided into two: hepatotropic viruses and non-hepatotropic viruses. So these hepatotropic viruses are hepatitis A, B, D and C. Non-hepatotropic viruses are HSV, EBV, CMV and yellow fever. So these are according to the categories how infectious they are, hepatotropic and non-hepatotropic. Then we'll see next slide. So here they are telling the types of viruses that are dangerous and more common in the human beings. You can commonly see in this function in the human beings. So the following 6 viruses cause 90% of cases of viral hepatitis. These are hepatitis A virus, hepatitis B virus, hepatitis C virus, hepatitis D virus, hepatitis E virus, hepatitis G virus. So here are 6 categories of virus which mainly cause viral hepatitis in a human being. Then see here, hepatitis A and E are responsible for most of the waterborne diseases or infections commonly acquired or community acquired. So the A and B are mainly caused due to the waterborne. That means whenever a person consumes dirty water or takes roadside food that is made up of dirty water, so the viruses present in those water get transferred in those human beings and affects the liver and cause inflammation of the liver. Then hepatitis, while B, C and D are responsible for post-transfusion hepatitis. Post-transfusion hepatitis means the person has a mild type of liver disease, but when the person is getting treated, so later on due to the prolonged suffering of the liver, he or she can have this disease condition A, B, C and D. Then since a considerable number of cases of both post-transfusion and community-acquired hepatitis are not identified as being caused by hepatitis A and E, investigators have sought to identify. Here it is telling the major number of cases are not found to be based on transfusion and community acquired. So the investigations are trying to find out that A and E are occurring or which type of viral disease are most common in the human being. Then other potentially hepatotropic viral agents include hepatitis G virus, TT virus and SEN virus. So these are other categories that include in hepatotropic viruses. Then although each type of hepatitis is unique, assessment, findings and treatment have many similarities. Since they are from the same class, that is they are from the same mother, that is hepatitis, and the children's are A, B, C, D, E and G. So they have more of the same characteristics and similarities. Then we'll see the routes of transmission. So their routes of transmissions are fecal-oral route, intrafamiliar sexual contact with an infected person, rarely parenteral ingestion of contaminated food. So these are getting entered into the human body through these of the transmitters. So like fecal-oral route, then intrafamiliar sexual contact, rarely parenteral, then ingestion of the contaminated food. Through these they entered into the human body. Then person at risk are travelers to endemic areas, sexual contact of infected persons, household members, men having sex with men, drug abusers. So these are the persons that are at great risk, because these cause very easily infection in those human beings and also persons with less immunity. Then the incubation period is 15 to 50 days. That is, these viruses take the duration of 15 to 50 days to grow. Then we'll see the etiology. So here is the etiology. Hepatotropic viruses A, B, C, D, E. So hepatitis A virus, most common cause of AVH 60%. AVH is acute viral hepatitis. So hepatitis A is the most common cause. HIV infected children below 2 years asymptomatic and above 5 years symptomatic. That means when the children get affected below 2 years, so it is very difficult to find the cause because symptoms are almost unknown. Then above 5 years children start showing symptoms. Then the route is fecal-oral route. That means whenever the children play in mud and with the dirty things and they put their hand in the mouth, so it is very easily the viruses get transferred in their body through their nails. Then next is hepatitis B virus. Acute and chronic hepatitis, acute liver failure. So hepatitis B is the cause for acute and chronic hepatitis and acute liver failure. Second most common cause of AVH. The first one was hepatitis A virus. The second one is hepatitis B virus. Liver cirrhosis and hepatocellular carcinoma. It also causes liver cirrhosis and hepatocellular carcinoma. Parenteral mother to infant sexual transmission. So these are the reasons of hepatitis B virus to get transferred into the human body. Then except in that, hepatitis C viruses, hepatitis D viruses and hepatitis E viruses are the etiological factor leading to viral hepatitis. Now we'll see what are the clinical features, how you're going to see the symptoms. Hepatotropic viruses, 3 possible courses, that is 3 main types are there, that is acute viral hepatitis, chronic viral hepatitis and acute liver failure. So in that we'll see this what are the signs and symptoms in these phases. So this acute viral hepatitis mainly includes 3 phases, that is prodromal phase, itric phase and convulsant phase. So you can see different types of symptoms in these phases. So in first one, that is prodromal phase, the person symptoms will be precedes jaundice, that is the children are most likely to have this and they will be showing the signs of jaundice. Then anorexia, nausea, abdominal discomfort, low-grade fever, malaise, myalgia lasts for 5 to 7 days. These were the symptoms. Then signs you are going to see: no itis, right upper quadrant tenderness, mild soft hepatomegaly, that is enlargement of liver, then arthritis, skin rashes, that is HBV, then occasionally mild splenomegaly. So these are the symptoms, signs and symptoms you'll be noticing in prodromal stage. Then we'll moving to the next phase, that is itric phase. In that the symptoms will be observed are yellow discoloration of eyes and urine, improvement of appetite, that is you can see child will be getting hungry or most often. Then feeling well and active, the child will be most since he will be eating so much, so he will feel active. Then lasts for 6 weeks. So these symptoms presides for 6 weeks. Then signs you can notice are jaundice of variable severity, mildly soft hepatomegaly, occasionally mild soft splenomegaly, scratch marks if itching. So children may have itching and you can see the scratches on the body. Then you can see the splenomegaly and hepatomegaly. Then we'll move to the third phase, that is last one, convulsant phase. So this you can see it is the severe phase of the viral hepatitis. So in this you will be noting symptoms like complete recovery of symptoms, mild icterus and fatigue for few weeks, signs icterus moderate to mild, normalization of urine color, regression of organomegaly. So this is the last stage where everything seems to be normal but the condition will be getting worse. Then we'll see to the most common symptoms. The most common symptoms include fever, malaise, jaundice. So these are the common symptoms that you can find in all the patients with the viral hepatitis. Then additional prodromal symptoms: fatigue, weakness, anorexia, nausea, vomiting and abdominal pain. Less common symptoms include headache, arthalgia, myalgia and diarrhea. So these are the common symptoms to be noticed in the patients. Then we are moving to the therapeutic management of hepatitis A, B, C, D, E and G, because these all account for the viral hepatitis. So we'll see the management. Treatment options for viral hepatitis are limited. The goals of management include early detection, recognition and chronic liver disease, support and monitoring and prevention of spread of the disease. Here it is telling that viral hepatitis treatments is limited because these all viruses are included in viral hepatitis. So mainly they go for the treatment of each viruses, and it is very necessary for the early detection and recognition and to treat the cause as soon as possible. HBV and HCV treatments is directed at managing the viral load to prevent further with interferons, naturally occurring proteins that exert antiviral, anti-proliferative and immunomodulatory effects. So it is very necessary to find out the HBV and HCV treatment and to treat the patient with the interferons naturally. Then lamivudine and Adipavir are two other interferon analogs that suppress the replication of HBV. So, replication of HBV is means that the viruses, when they enter into the body, they grow rapidly by dividing from 1 to 2. So, we have to try to stop the replication so they cannot grow. So, for that, lamivudine and Adipavir interferons are given to suppress the replication. Then a combination of alpha interferon and ribavirin has resulted in sustained response in only 50% of the patients with HBV and HCV. So combination of interferon, that is alpha and ribavirin, cause only 50% positive result. Another important aspect of therapeutic management of hepatitis involves hospitalization. That is, it is very necessary to hospitalize the patient if the patient is having viral hepatitis. Hospitalization is necessary if coagulopathy or fulfillment hepatitis is present. So it is very necessary to hospitalize the patient if the patient is having coagulopathy or fulfillment hepatitis. A recent interferon formulation, pegylated interferon, can be administered once a week and has been found to sustain plasma level and enhance viral suppression. So here interferon is a type of drug, viral drug that can be administered, and here they have found a recent interferon, that is pegylated interferon, that can be administered once a week and is very helpful in suppressing the replication of the virals. Then HIV infection is an acute disease that resolves with support and management of symptoms. So if HIV symptoms are there in the patient, so we will try to separate it with the management of the symptomatic treatment. Then we'll move to the nursing management. So in nursing management, if further assistance is needed for parent to comply with therapy, a public health nursing referral may be necessary. A well-balanced diet and realistic schedule of rest and activity adjusted to the child's conditions are encouraged. HIV is not infectious within a week after the onset of jaundice, and children may feel well enough to resume school. So when the person is having hepatitis, so it is very necessary to make them have a complete bed rest with the doctor's advice, and a well balanced diet is very necessary. Then hand washing is a simple most critical measure in reducing risk of transmission. So hand washing should be made compulsory. Then the nurse should explain to the parents and children the way in which HIV and HBV are spread. So health education to be given to the patients as well as their family members to avoid the transmission of disease. Nursing caring of young people with HBV virus and a known or suspected history of illicit drug use should help these teens realize the dangers of the drug abuse. So it's very necessary to educate the youngsters about the disease condition. And nurses should stress the parental mode of transmission of hepatitis and encourage them to seek counseling through a drug problem. So it is very necessary to increase the stress the parental mode of transmission for the patients. Then many communities have multidisciplinary clinics dedicated to the management of these diseases. So it's better to have the focused treatment if it is possible. And we can move to the nursing diagnosis and planning. So these nursing diagnoses are planned according to the patient's conditions and priority. So in this condition, mainly we are advising for the good diet. So first nursing diagnosis will be based on the diet. The following nursing diagnosis and expected outcomes may be appropriate after assessing the child with viral hepatitis and child's family. That is imbalanced nutrition less than the body requirement related to anorexia. Then expected outcome, the child will tolerate an age appropriate diet without weight loss. That means you have to try to improve the balanced nutrition of the patient, and you have to expect for the good result. Then we can move to the next diagnosis, that is expected out. This is not the second diagnosis. It is telling the here it is, deficient knowledge related to incomplete information and home caring and long term prognosis. So patient should be knowledge should be now provided knowledge of taking care of the patients with viral hepatitis, so that the disease should not be transmitted from one to another. Then risks for injury related to fulfillment hepatitis. If the person is having fulfillment hepatitis, so there is a great risk, so we should better educate them to have the distance and take care of the patients properly. So that's all for the today's class. Thank you to all the students.